I don't know about my heart. I want to stay with me.
And today it's my honor and it's my pleasure to welcome you to the first National Food Fortification Conference. The conference focuses on both mass fortification and also home fortification. We are happy today to really just celebrate, as our theme says that we are here to trace the steps and to celebrate the achievements in addressing micronutrient deficiencies.
Looking at the fortification that we are talking about, you've heard about mass fortification and home fortification. Now, in mass fortification, we are talking about the addition of micronutrients to foods commonly consumed by the general population, such as salt, sugar, flour, edible fats, and oils. You'll find that out of the food consumption survey that was done, these are foods that you'll find in every household. And we thought these are the best to carry the nutrients that are missing so that each member of the family can get benefit from it. The other is home fortification. We know that through mass fortification, we may not reach 100% of the population. We are therefore introducing micronutrient powders, and this is an addition of nutrient-rich premixes to food before you eat it. We are here to celebrate. It's not just about the project which has just been implemented, but it's good for you to know how we have come this far as a country. Now, in 1970, we had one of our companies called Kensalt voluntarily fortifying salt with iodine. And you know, iodine used to be a problem. We used to have goiter in this country. But now we are also celebrating because it has come down from 21% to 6%. Now, 1978, we decided as a country to have mandatory fortification of salt, and all salt companies complied, and they are all fortifying.
We work unlike many other organizations. We work through partnerships with the private sector and with the public sector. We are a civil society organization, but we believe that we cannot achieve eradication of malnutrition if we only concentrate on the civil society, or if we only concentrate on the public sector without the involvement of the private sector. And as you know very well, in this country, even those farmers who farm, they know that what they eat is sourced from the markets, isn't it? We buy a lot of what we eat from the market. What you have been eating this morning, what you have been supplied in this hotel, are all supplied by the private sector. So what the private sector puts on our table is what determines our nutrition status. We need to move together. We need to make that progress together. And somebody said, if you walk alone, you can go fast. But if you walk together, you will go far. Let's go far in the journey to nutrition in this country by holding hands together.
Thank you so much to the private sector. Who fortifies? It's the private sector. If you do not want to fortify, the laws will be redundant. Thank you so much. I want to join the voices of the previous people to really thank the private sector. The greatest step that I saw was that the private sector started it before the public sector. 1970 to 2001, voluntary fortification. That contributed to the health of this population in this Kenya.
The EU support the food fortification, and I'm particularly pleased to be here today to announce that EU is indeed preparing a package of 35.5 million euro to support food fortification in 12 of our partner countries. And I'm particularly pleased to announce that Kenya is one of the 12 countries.
We really appreciate the our Ministry of Health, because they are coming out with a regulation or a policy which is going to give us a way of implementing all those standards, because when we have a policy and within the East African community, we understand that we need to protect our people and their health. Somebody said here, it's better prevention than cure. And here we already have the ministry which has recognized that need, and we are able to now ensure the products are produced, and KEBS is ready to take its second role through its mandate to ensure those products which are produced are not harmful to the consumers due to poor quality or chemicals being put.
The key thing is partnerships. And to steal from Aidan a little bit, earlier we talked about a term he introduced in terms of mainstreaming partnerships, mainstreaming nutrition. And it's an important, I think you have a very critical role to play in the job that you have. And those partnerships are not only partnerships at a local, Kenyan level, but also partnerships at a regional level.
The Kenya government recognizes and appreciates the role micronutrients play in maternal and child survival, and has put in place strategies to address their deficiencies. These include promotion of breastfeeding to children up to 2 years, home fortification of complementary foods with micronutrient powders, promotion of dietary diversification, vitamin A supplements for children 6 months to 59 months, iron and folic supplementation to women, and also food fortification with mandatory fortification of salt, maize and wheat flours, and vegetable fats and oils. Food fortification is our area of focus today, and it is one of the interventions that have proven to be visibly affordable, easy to implement, and reaches out to a large segment of the population. It's now my pleasure, ladies and gentlemen, to declare the National Food Fortification Conference officially open and launch the fortification materials and database and present laboratory equipments to the National Public Laboratory.